Welcome back to another PCBH Corner, and I am so excited. I am joined by two fantastic guests. We have Beth Childs and Dr. Michael Baca-Atlas, and just so pumped for you guys to get to know these two. And even just in the last 14 minutes that we've been chatting before we hit record, we already got good stuff. So hopefully we can bring that magic to now the PCBH Corner now that it's recording. We have Beth Childs here, who's an LCSW by trade and was a director of behavioral health in an FQHC for almost 10 years, and actually was just telling me how she literally just switched her roles and has a new job where she works as a value-based consultant for FQHCs. So I think, Beth, you said just in the last month you've made the switch? All
Yes.
right, but still working with FQHCs.
Yes.
And I think that that will be one of the themes of today of talking about working with the underserved. And then Michael is the medical director of Enhanced Primary Care, and where they specialize in specialty mental health, or sorry, severe mental illness and substance use disorders, and still does a lot of clinical work. So both of these two are co-chairs for the upcoming CFHA conference and are part of the committee in the planning committee. And I'm already excited. Michael teed me up. Well, on that, I'm going to tee him back up with saying that there's an interesting story behind why we're having the conference in Raleigh. So maybe we should just get right to it. We got CFHA in Raleigh, North Carolina. So what's the situation there? What's the story behind it?
Well, obvious it's the best city in the world. No, so I didn't know anything about CFHA until about 3 years ago, where we have a grant in our family medicine program at UNC. And essentially, we're working on integrated care. We actually added a BHC to our program, which was the first ever in the history of our 50-year residency program. So super awesome about that. I've been to the conference now twice, and there was just something, like you said, kind of like the magic of being with folks who are like-minded around integrated care and primary care. And honestly, like I came home from the second conference and said, I'm just going to apply and put in an application for Raleigh. I called everybody I knew in the state. These are people at like academic institutions, FQHCs. I talked to Beth because Beth was at the conference. I was like, Beth, I think I want to do this. And lo and behold, we got accepted to have the conference in Raleigh. And it also is just a little convenient for me because I can actually walk to the convention center from my house. So maybe it was like a little bit intentional on my part to have the conference in Raleigh, but we're super excited. And honestly, just the magic of attending the conference for me, I tell everybody about the conference now just because it's so special bringing so many different professionals together, kind of all of us having similar goals around integrated care. So it's been super fun, and I'm really excited for the conference.
Yeah, I was interested, a huge part of CFHA is trying to have the interprofessional team and to expand and not necessarily just get pigeonholed with one guild, so to speak. So obviously, I'm a psychologist. Beth are an LCSW. Michael, you're an MD. So what was your experience like as a physician to go to the conference? And you said that obviously the energy felt right. Yeah, just what was your experience as a physician?
Yeah, I really like that there weren't other physicians around. I'm kind of someone that really like enjoys my interprofessional colleagues. My clinic has two peer support specialists, a social worker, multiple CMAs, RNs, lots of different people doing lots of different things. And so I felt really comfortable kind of being in a space and just kind of being really impressed with what my psychologist colleagues were doing. I hadn't known really much about BHCs and kind of the model of care. So just like understanding all the things that I hear my colleagues complain about in clinic, that they wish they had support for mental health and they wish they had someone who could just kind of take a warm handoff, like to know that that's being successfully done. And obviously that's, I think, one part of, CFHA is kind of that BHC model, but to see that being done so well, I was really blown away. And we really said like that this is something we have to have as a part of our grant. It's something we have to bring to our academic center. Our primary care clinic, our main primary care clinic that I don't work at, but I trained at as a resident, has almost 65,000 visits a year. I mean, it is a very robust practice. I think there's like 70 plus faculty members. And so just the idea of bringing in more support around behavioral health has been absolutely transformational for the practice.
Oh my gosh, that is just, yeah, that just is so exciting to hear that you're trying to bring that there, and there's such an opportunity to help so many people. Now, Beth, you obviously, Michael said that he reached out to you. So
He
you
did.
obviously got some type of email or text or call. How did you get roped into this thing?
Roped is a great word. Um, yeah, Michael was like, "Hey, I want to do this. If I do it, will you be my co-chair?" And I was like, "Sure, why not? Let's do it." Because I, like Michael, I love the conference. I've been 3 times, and I every single time I come away with new things to try, new things I want to try with the team that I was leading. So yeah, I was super excited, super excited. I do want to, follow up on what Michael was saying about like his experience and, as an MD at the conference, is, one theme I think that, came to the planning committee when we were trying to come up with what will our theme be, is this idea that there is no wrong door for integrated care, right? So Michael mentioned peer supports and nurses and CMAs and doctors and psychologists and social workers, et cetera, et cetera. Like that really was a theme that the planning committee discussed lots. Is this breaking boundaries? That's where that came from, which is it doesn't just have to be the psychologist or the social worker or the BHC, right? It's everybody, it's anybody who's doing this work. And so that was a really important theme that came out of our discussions.
Yeah, I guess that actually really is another kind of great segue here is, when you're going to put this together, I was telling them before we hit record, like, I don't necessarily know what goes into this. So, you come up with this theme and you're taken from previous conferences, and it's probably going to be a little bit difficult because you want to recreate some of the magic for the ones that you attended, which inspired you to do this, but you probably want to put your own flair on it. Is
Mhm.
there a certain spin that you both were? I mean, I guess you just told me the breaking boundaries and making sure that there's no wrong door. But yeah, anything else that you're really looking forward to being like, okay, we're going to execute it this year, and I hope that people walk away with blank as a result of coming to the conference?
Yeah, I hundreds of hours with AI designing the theme. No, I'm just kidding. We had like a couple keywords or buzzwords. So, Medicaid got expanded in North Carolina, so expansion was a really big important part. Obviously, there's a ton of conversation about access right now in primary care, and availability is just so important. And so Beth and I, when we were talking about themes too, you don't want to say, for example, like this is the breaking boundaries COCM, because not everybody's doing that. We want to make sure that when someone opens up the conference page, that it's sort of, again, inviting, and also to know that people are going to hear from a lot of different speakers from a lot of different backgrounds. Beth rattled off a ton of professionals. We actually have some dental presentations from people doing integrated care in the dental field. So just to know that like this can really serve anybody at all who might attend the conference, who's even like a tiny bit focused around mental and behavioral health, that wants to sort of incorporate that into what they're doing. My hope, and I think Beth and I's hope, was that the theme would really kind of draw people in regardless of sort of where people were and what kind of setting they were working in.
Wow, that's awesome. Yeah, Beth, what are you, I see your wheels turning. I love it.
Yeah, yeah. No, I mean, I totally agree. One thing, that we were thinking about just as an example, is at my FQHC where I was, we had a partnership for post opioid overdose response, right? With, emergency management folks. And so that was even an idea. It was like, hey, let's invite them, or let's invite them to do a presentation on the work that they're doing. And when you think integrated care as a BHC, if you're sort of in that space, that's not maybe your first thought. in integrated care. But that truly is integrated care, because one of the main parts of that partnership was to get them to primary care, right? To get them into medication assisted treatment. And so that really was, to Michael's point, like the access for all, anything related to integrated care.
Yeah, there's that interconnectedness, right? That you guys are, yeah, the interconnectedness of being able to go out there and take care of people and help engage them in care so they can, be an advocate for their health care as well.
Right.
Wow. All right. So you both mentioned, Beth, you said that you went to, was it 2 years? No, 3 years, 3 years of CFHA and the annual conference, and then Michael the last 2 years. So this is going to be your third. So, for people who might be thinking, this is my first conference, or kind of maybe on the fence of whether or not they're going to sign up. Like, well, there's a lot of conferences, there's a lot of things I can do. Is there any message that you would have to first time attendees
Mm.
uh, that you'd really want them to hear? Let's see
Yeah.
if you can
So, I
push them
mean,
over the edge to get signed
yeah,
up.
yeah, I will say first and foremost, doing this work, this is hands down the best clinical conference, that I've ever attended. And there's a couple reasons why. Initially for me, when I attended, so my first conference was Denver, that I attended. And I don't know, like doing integrated care, as a social worker, you have to get CEUs, that kind of thing. And I just remember prior to that conference, I would go to a conference on, let's say, CBT or something. And I'd be like, okay, this is great, but okay, how do I make that work in what I'm doing, right? How do I make that work in primary care? And when I came to the conference, it was like, what? It was literally like, wow, these are my people, right? Like, I just look around, and I remember actually my husband went with me on that trip and explored Denver and all of that. But I remember, talking to him afterwards and going, these are my people. Like, I love this. This is amazing. I felt like just such a sense of camaraderie and that kind of thing. So I would say that is like huge. And every conference since, I have felt that same thing. But I would also say, like, the other big thing for me as a clinician, especially, and a leader, because I've learned a lot in both ways, is you take stuff with you. So you literally will leave that conference and be able to use strategies, tools, things like that, and be able to use it when you get back to work on Monday. Like, just like that. And that to me has been probably the two biggest things that I have taken away from the conference.
That is so special, Beth. And I know that from talking with Neftali in the past, he has hit that really hard. So I'm so glad that his vision of having this conference where you can go and take, literally, like you said, you don't have to now, okay, well, CBT, now I have to go and customize it or adjust it to work in the setting. It's like, you get to go and learn about things that you're actually, gonna go do, and then walking away with these practical tools as, as a BHC, but also as a leader, and just kind of working in that. Yeah. So I agree with you that, that's definitely a huge experience. And I think that Neftali kind of had a really great vision for that. Yeah. What are you thinking, Michael? Similar lines or?
Yeah, I mean, for me, like I felt in my training that family medicine, like it was sort of my people, and you sort of do that training background because of that. And then honestly, like since then, kind of like finding your place as a sort of young professional, and then being able to come to this conference and saying like, wow, even just going to the conference for 2 years, I'm emailing people and messaging people and keeping in touch with people like afterwards and sharing ideas or doing different things. And so I really feel like I mean, bar none, the content is great. And I think, like, maybe even more importantly, are the connections, and sort of everyone is just very reachable, like at the conference. I remember there was, it was like the health minister of like Canada's mental health system. And we just talked for like an hour after his presentation at the last conference. I was like, you're a huge deal. Like, your name is the first author on this like manuscript for the entire country of Canada. And so to like just have those connections, and people are just so humble, and I agree that I think, yeah, Neftali said that when I first came, and I was like, yeah, I don't know if I really believe that, but really, I do feel like now, after having gone a couple times and now having planned, it is just this place where kind of everyone is really there to really like support the communities that they come from and work from, and I feel like that translates so well across everybody.
Yeah, that networking, but not just like the sterile, like, okay, we're
Yeah,
gonna go to a networking event, but
yeah.
truly having it be that community is definitely uh I think you guys, dang, you guys hit the nail on the head. I feel like with both of your, like, that really kind of sums up. So that's good that you all are in the planning committee so that you can so that you can definitely, get that going for 2025.
Well, I
Uh
told I told Neftali when I said we were going to do this, I said, maybe you put something in the water like at those conferences because now everybody comes back, they want to plan conferences, like all of a sudden I'm like a sort of like a follower here. But no, it's a really, nobody tied my hands and said like Michael, you need to do this and you need to drag Beth along with you. Like it just felt like one of those things you wanted to be a part of, and it's something really special about the organization.
Yeah, and I guess this might also be a good segue of, almost kind of a few tips for how to conference. If you're going to go to the CFA 2025 and Raleigh, North Carolina conference, I feel like you've already served up a couple here of saying, hey, people are accessible, go talk to people. But yeah, a couple of tips so that people get the most out of it.
Yeah, I'll start. I will say it's super hard to choose between sessions because there's so many great sessions, right? Going along. And so I would say if you're coming to don't wait until the day of to choose your sessions, right? And with that, don't worry if you switch your session up either, right? Like you can switch up if you decide, oh, I'm going to change my mind last minute. But I would say actually put a little bit of thought in there about like what are you looking for? What are you trying to get out of it? So if you're looking for, strategies, if you're, let's say you're a new clinician, right, doing this work, there's a lot of sort of primer levels, if you will, or intros, or that kind of thing with practical tools. If you're a leader, there's a lot of those kinds of more high level or leadership kinds of things. Looking at those. If you're both, maybe mix it up a little bit and do those things. But I would definitely say don't wait to the last minute to choose those sessions, just because you want to sort of think about it a little more thoughtfully. But again, don't worry if you switch up at the last minute, it's okay. And another suggestion I would have about the sessions that you're looking at, the ELOs are always a great option. They're not included in the cost of the registration. They're a little extra, but I would say they're absolutely worth it if you want to deep dive into a topic a little more lengthily, because those are 3 hours typically, and the sessions are an hour 30 minutes, and so you can do more of a deep dive. And I have gone to an ELO every time and I've never been disappointed. They've always been great.
Beth, those are amazing pro tips. So definitely get that review of the sessions prior. And like you said, don't be scared to call an audible, but try to put a little bit of intentionality in prior, not just the day of, and then attending the ELOs. And I agree with you that they're a huge value. And yeah, it's a little bit of extra, but at that point, you've already dedicated so much time, energy, and finances out that way. So it's really actually like not that much, and like you said, well worth it. Great pro tips, Michael. Any tips on your end?
I'm just going to piggyback off of Beth a little bit that with the kind of picking your sessions, like I always say, have maybe two or three at the same time because oftentimes those lectures, like some people are turning them in relatively late, close to their session. And so you may be able to kind of look at a PowerPoint and say, God, like, wow, that's really interesting. But I can maybe there's some other session that's going to be a little bit more hands-on, like workshoppy. And I think just as an individual kind of figuring out like there may be like an awesome content thing, but you might say, gosh, I might want to spend a little time somewhere else. So I'm going to like star that, lecture, look at the slides later, kind of do my own review, but then go to another session that sort of talks about, for example, like how to build a program or how to track your BHC encounters or how to kind of really get into the data of what you're doing. And so to Beth's point all the way, it's so hard because there are so many amazing sessions. Like if you roll up and sort of do that, I think that can be overwhelming. So definitely a couple days prior, maybe on the plane, if you're flying, good use of time for sure.
Yeah, wonderful pro tips. So on the same vein about being excited about the conference, is there anything in particular that either of you are personally just really excited to have happen? Maybe it's a session, maybe it's something that you are excited to introduce folks to in Raleigh, like I don't know, like, hey, if you come to the city, you have to come here. But just kind of maybe selfishly, what are you looking forward to with the conference and what are you most excited about?
Mm. I'm gonna let Michael go first on this one.
Yeah, there are like so many things. Like we could spend an entire just hour about what components. But for me, like two areas with definitely some support from our planning committee, I am super duper jazzed about is we have the Racial Equity Institute is doing an extended learning opportunity. Those sessions are usually much more expensive in the community, and we've been able to work with them and to offer that. They are a Black-owned business here in Greensboro, North Carolina, and they do incredible trainings across the country, across the state. I'm super excited about that. And then also like a good friend of mine who is a psychologist, I was able to kind of like rope her into coming, is Dr. Gabrielle Jones. She is the author of Culturally Responsive Substance Use Treatment, and she's going to actually be doing a book talk during one of the concurrent sessions with one of her collaborators. And so I am just super excited to really bring that content and really highlighting that. And I think CFHA generally does a really good job of talking about equity related issues. I remember a conference or two ago, like all the plenaries were really focused on kind of racial inequities in research. And so really want to make sure we continue that theme as part of the conference has been really meaningful. And I'm really looking forward to it.
Wow, that's so exciting.
Yeah. Yeah. I'm excited about those too. I don't know if I'm going to be able to get to all of the things. It makes me stressed out just thinking about it, but
Don't stress. Don't stress.
I know. I would say that I really am looking forward to, outside of the things that of course Michael has already said, is our plenaries. I'm really excited about them. I think we have a really diverse in group of folks who are going to be delivering those, and with different content and things that I think will really intrigue our audience. And so I'm looking forward to those. Yeah.
And then I just have to make a plug because I live in Raleigh, like actually live very close. It's like one of the things that sometimes you go to conferences, like I was just at an addiction conference in April. I'm not going to like name names here, but like it was like in Denver, but it was like 40 minutes outside of Denver. And so this conference, the convention center is like downtown and the hotel is right downtown. So you step outside and you are in downtown Raleigh. And it's just a really cool city. It's very green. There's just lots of great restaurants, places to hike. There's also going to be the state fair, which is like maybe 20 minutes or so from the conference. So people are bringing like family or kids. Like the state fair is like really interesting. And I actually had not been for like 10 years. I went for the first time last year and it was pretty cool. So there's just like a lot to do, a lot for friends and family. But that the conference is like, we're not 40 minutes outside of Raleigh. We are right there. And you walk outside the hotel and there's just tons of stuff to do.
Yeah.
Well, I mean, you just, again, served it right up. Nice segue. What is maybe like a restaurant or something to do in downtown, or maybe a park that's just like you can't, you should not miss this type of thing?
That's Michael.
Do you want
I
me?
don't
Okay,
live
I
in
was like,
Raleigh, so
there's literally,
Sorry, Beth.
I'm
I
not
got
gonna,
excited about Raleigh.
I'm not gonna self-identify as like a foodie, but I may or may not have eaten at most of the restaurants in Raleigh, North Carolina. But there honestly, there's just a little something for everyone. One of the two of my like favorite places right now are we have these really large food halls. So there's like 20 restaurants in the food halls, and those are actually in super close proximity to the conference. So if you're someone who like doesn't want to go and I don't know, sit down at a restaurant, you kind of want to have like a little bit more of like a social gathering, like bring like 20, 30 members of your team. The food halls are like a really awesome place to do that because honestly, I get like super stressed out about like booking reservation for like 15 or 20 people. And you don't really have to do that. There's like enough places that sort of offer outdoor space, where, and Raleigh has a really also, just not to promote like alcohol use as like an addiction medicine specialist, but there are like a lot of breweries, which, and I'm not saying that to go drink, but just also like places that have great food and can entertain a lot of people at one place. So
A lot of them have NA options, I would imagine,
yeah.
the non-alcoholic options too. So,
Yes. Yeah.
and in Washington, where breweries are really popular, almost all of them will do an NA option, both for beer and I've seen now cider too. So, those have been blowing up, which is definitely another great option for people.
Yeah, for sure. But lots to do and lots to see.
All right. Now, Beth, do you have
Recommendations, Michael?
All right. So I think that this has been, I mean, you guys got me more pumped, which I'm always pumped for CFHA. I've been attending since my first, I think it was Denver 2013 was the first time that I went to CFHA. And I actually had to miss Denver. I think it was 20, was it 2019, Beth? Oh,
That sounds right. It was
yeah.
definitely before COVID. Yeah.
Yeah, Dave and I missed it because of a family wedding. So never again will I miss CFHA if at all possible. But family wedding, I don't know. I
Yeah.
know, very kind of. Uh, so as we're kind of wrapping up here, is there anything that when we had discussed doing a PCBH corner that you were really hoping that you would be able to get to say that we haven't talked about or we haven't gone over? Now I think would be a great time to kind of hit on anything that we haven't talked about.
Not for me. I think we nailed what I was thinking about. I don't know about Michael.
I was just gonna say too, if people listen to this or like just, please reach out, or, if there's stuff that people like, or we still have like a little bit of time before the conference, obviously. So just if there's ideas or people things they're thinking about or would like to see or have, kind of at the conference in particular. I'm personally very interested in having like some really good snack options. I am working on some food trucks being a part of the conference, like fingers crossed that we can kind of make that happen. So those are just like little things. But if others have any other ideas, like Beth and I are really excited about that. And then Bridget, I only have one question for you,
Oh,
is that there were t-shirts at the last conference. And so I like, for my own sanity, because I think I got one, but I got it actually for someone else, my BHC who's now hired. I don't have one. And so it's really important for me to
oh,
know like if I can rely on you all at the conference for this.
that's so interesting. Dave and I have been putting it on our to-do list because we're not sure what to do about it because CFHA, it was like a
Me
whole
too.
thing. Dave and I may have created a lot of controversy because we have the PCBH Life t-shirts. And then there was some threads on the email about like, hey, that's not very like inclusive. And I'm like, well, I
Oh,
I'm not against anyone else. I'm just for PCBH life. It doesn't
right.
being for something doesn't make me against something type of deal. And then,
Right.
so then CFHA came out with the t-shirts because we had talked with the Neftali. So now they have CFHA t-shirts. So Dave and I were like, I don't know. So we kind of we haven't made a decision yet about the t-shirts. But now you're giving me fodder. And
I'm in full support. Like I think that, unless there's like a clause that says that t-shirts can't be sold at the conference,
That's
in the conference, or that we yeah, I'm trying to think of other mechanisms where like people could like purchase and then it gets shipped later, but that gets a little bit complicated too in terms of your guys' time and effort. So if we need to warehouse them or they need to be shipped to my house or whatever,
oh,
I am in like full support of getting creative about how to. They were very popular. I mean, seriously, they were like super popular. So, you know.
I
you
didn't get one, but I did get a
oh,
conference t-shirt.
Oh,
So yeah, so I wore
what?
that today. I thought that was a good day. I'm also gonna wear it at the conference, of course, but
Beth, did
so
you purchase that on your own or did someone
I
ship that to
did.
you?
I did, yeah. And
Okay.
I was on the
All right.
website today, looking at other ones that they had. I was like, do I want a different color or no, this is just the only one I need. But
I
I saw
do
the
have to.
PCBH t-shirts too. I didn't get one either. I don't know. Yeah, I don't know. Maybe I didn't see where they were for sale. I don't know.
It was on the listserv.
And they were
Ah,
also out of a piece
okay.
of luggage at the conference the last time as well.
Yes, it
Okay.
was my personal luggage. So basically, they just like sent it out on the CFHA listserv, and whoever said yes, I just bought a bunch and then got a suitcase and filled them with, and then rolled them out behind the registration. And CFHA staff, I was like, so is it okay if I just set up shop here? I mean, I got them at cost, so it was just like, I don't know how much money I lost on them, but I think it was a lot. I actually don't even care. Honestly, it wasn't that much. It was maybe a couple hundred. It was so fun that you know what, Michael? I think we may have just got me to agree, Dave and I to agree to do it again.
Dude, and
So,
I'm happy to go in if it's, $10,000 or $50,000. I'm happy to buy some shirts, split the cost. Who cares? Um, it's worth it. It's totally worth it. I did want to make a plug really quickly as well, Bridget, that this incredible design behind us was
mhm.
done by Leanna Edwards, who is on the CFHA staff. And Beth and I kind of gave some ideas, and I think she knocked it out of the park. I think it's such a cool logo. And just also like a huge thank you to the staff who have to, I think they don't tolerate me very well necessarily in the sense that I give them. I sort of like have a lot of asks, and so I really appreciate the CFHA staff kind of being really thoughtful and creative and doing some different things. And so I'm hoping people really get to see that this coming year at the conference.
They have been amazing. They're
Yeah,
wonderful to work with. They really are.
yeah.
Wow. Well, I always love CFHA, and I've always loved CFHA's conference. And this little, however long talk, this PCBH Corner has got me even more pumped. So I'm hoping that if you are watching this episode, you feel the way that I feel. I hope you feel Beth and Michael's energy and their creativity, and giving us a little bit of a glimpse behind the scenes of all of CFHA staff, from Neftali to everybody who's doing their work, that they're planning this to make a special experience. So definitely show up, get signed up, review the sessions. Don't be scared to call an audible, and definitely don't be scared to network. And like we said, more than network, connect with each other and make a community here. So yeah, let's go CFHA 2025, and just really appreciate Beth and Michael.
Thank you, Bridget.
Thanks.
Thanks, guys. Where is stop? Oh, there it is. Stop.